This skill is putting on sterile gloves and removing soiled gloves. Perform hand hygiene. Check the sterile glove package. Make sure it's dry and unopened. And note the expiration date. Place the sterile glove package on a clean, dry surface at or above your waist. Open the outside wrapper, carefully peeling the top layer back. Remove the inner package, handling only the outside of it. Lay it in front of you and make sure the cuff is the closest to you. Carefully open the inner package. Fold open the top flap, then the bottom, and then the sides. Take care not to touch the inner surface of the package of the gloves. First, you're going to glove your dominant hand. With the thumb and forefinger of the non-dominant hand, grasp the folded cuff of the glove for the dominant hand, touching only the exposed inside of the glove. Keep your hands above your waistline. Lift and hold the glove up and off the inner package with fingers down. Be careful that it doesn't touch any unsterile object. Carefully insert the dominant hand palm up into the glove and pull the glove on. Leave the cuff folded until the opposite hand is gloved. Hold the thumb of the gloved hand outward. Place the fingers of the gloved hand inside the cuff of the remaining glove. Lift it up from the wrapper, taking care not to touch anything with the gloves or the hands. Carefully insert the non-dominant hand into the glove. Pull the glove on, taking care that the skin does not touch any of the outer surfaces of the gloves. Slide the fingers of one hand under the cuff of the other and fully extend the cuff down the arm, touching only the sterile outside of the glove. Repeat this for the remaining hand. Adjust the gloves as necessary, touching only sterile areas with other sterile areas. Sometimes your student, when they go to put their gloves off, will make a boo-boo, and they will end up putting on their gloves kind of like this, where they get their fingers get put into, two fingers will get put into one. Just tell them not to worry about this, to go ahead and put on their other glove, making sure they stay sterile. And after this glove is on, then they can go ahead and correct their mistake. This happens a lot. Their fingers get sweaty and they get nervous, but make sure they know that that's normal and they can go ahead and correct it. Now we're ready to remove our soiled gloves. Use your dominant hand to grasp the opposite glove near the cuff and on the opposite outside exposed area. Remove it by pulling it off, inverting it as it is pulled, keeping the contaminated area on the inside. Hold the removed glove in the remaining gloved hand. Slide the fingers of the ungloved hand between the remaining glove and the wrist, taking care to avoid touching the outside surface of the glove. Remove it by pulling it off, inverting it as it is pulled, keeping the contaminated area on the outside, and securing the first glove inside the second. Discard the gloves in an appropriate container. Remove additional PPE if it has been used. Now you perform hand hygiene.